I didn't take it personally.
Well, we're trying it on the actual computer now. I'm not on the iPad. Hopefully the internet speed will sustain enough to keep us rolling. It's always one thing or the other. Try to do it. Welcome, everyone. I hope you guys got links to both the meeting packet and the Padlet for today in your invite. If anybody doesn't have that, as you may have realized, we're experiencing a very slow internet speed. So when I try to actually pull anything up on my computer, I think it's going to endanger the speed to carry on the actual Zoom call. So I'm going to ask you all, do you need that link, or are you able to access the link to your meeting packets?
Okay. I don't need it.
I can access my link.
Okay, it might be that I'll ask one of you folks to share if we need to share it, just because I think that would then pull on your internet as opposed to my internet speed. If that is good, Denise, I might call on you for that. All right, why don't we go ahead and start quickly with, I think everybody knows everybody, but I'd enjoy a chance to hear any updates you have from your various corners of the county. Barb, anything on your end? Barb Jones?
Hi, good afternoon. Barb Jones with the Jefferson County Public Health CHIP program. And no, I guess the one thing that I would just say for the purposes of this group is the youth age band group and their behavioral health zero suicide efforts are kind of launching into an effort to develop community-based training. So anybody who is interested in plugging in for or have organizations interested in plugging in for youth suicide signs, symptoms, and how to respond as an adult supporter, let me know, because we'll be moving in that direction.
Excellent.
I think that's all I have. Thanks.
Okay, thank you. Jake, what's going on at the hospital?
Hey, Jake Davidson, Jefferson Healthcare. Lots of stuff. I think the most exciting for this team is we're adding replacing LICSW in our primary care, which we've been searching for gosh, probably over a year. So it's exciting news.
I didn't quite catch. Did everybody else? What is it that you're replacing?
Oh, sorry, an LICSW with our integrated behavioral health program in our primary care facilities.
Oh, that's great news. Thank you, Jake. Denise Banker.
Hi, Denise Banker. I am the Community Health Division Director at Jefferson County Public Health. And, you know, Anya will be updating a lot of the work that she's doing in harm reduction. I've been working pretty steadily on securing amendments for and funding for our school-based health clinic, mental health counselors for the next school year, have supported the student assistance professional down in Quilcene by paying the school district's match. for that position to continue to support student mental health and behavioral choices, positive behavioral choices down in the school district in Closing. And gosh, I have so much stuff going on that it's hard to just list it all off. So glad to be here. And I'll keep doing the good work.
Happy to have you here, Denise. Rebecca, what's going on at the therapeutic courts?
Oh, nothing particular I can think of to update today because my brain is a little mushy. We had a very long day, but other than that, one of the things we're doing right now is just kind of talking about the forward direction of family therapeutic court, and based on all of the changes in law and things like that. So we're having a lot of discussions about how that court is going to work going forward, and we'll keep this group posted.
Great, thank you for being here. Chief Black.
Yeah, pretending to know what I'm doing on building my house next door. I took the day off, so sorry I'm not in uniform, but glad to be here for East Jefferson current events. We have a cohort of 5 new firefighters that are going through their recruit training right now. They're actually at the burn tower today, out at Jacob Miller Road, just polishing their skills, and they'll be hitting the regular shift in 2 weeks. And then I would say organization wide, we're waiting on good news. We're only accepting good news for grants, regional, statewide, and federal grants over the next 60 to 90 days. We have more than half a dozen grants that we're hoping to hear something on so that we can plan for the future. It's pretty exciting.
Well, we're all keeping our fingers crossed for you. Thank you for being here. Richard Davies.
Hello, happy to be here. Public defender here in Port Townsend, continuing to represent individuals charged with crimes who, in large part, suffer from SUD issues as well as mental health issues. SUD issues as well as mental health issues. Thanks.
Thank you. Lori Tinker.
Hi, Lori Tinker. I'm the chair of the EMS Council for Jefferson County. And a lot of things going on, probably just secondarily as a point of information for of interest to this group is that some of the transport contract has changed. So the interfacility transports, which would include our mental health, behavioral health transports from our hospital to other facilities, has changed a bit. And so we're going through a transition, which is always fun to ride over those few little bumps for during the transition time. But everybody is in good spirits and doing well with that. And I think at it's today, Thursday, Tuesday meeting of our council was the first time in many months, it seems, that I reported that not only did we not have any COVID patients, we had no boarding patients in our ED, nor long-term difficult discharge patients up on the floor. And those patients most frequently were behavioral or mental health patients or had a component of that. And so that is really significant. I haven't checked today, Jake, so do not call me a liar if that's changed. We'll check in next month with that number, but so far so good. That's about it.
Great, thank you, Lori. Gabby, anything you want to update us on in your corner?
Gabby Caudell with Believe in Recovery. What's going on? We have a lot of really exciting things happening. Probably going to be more ready to announce those exciting things at the next meeting.
All right, great. Everybody remember, meeting in July, but we will be meeting in August. So you'll have tons of stuff by then, Gabby. Lisa.
Oh, I will actually, yeah. It would have been July, but
Lisa.
I'll wait till August.
I'm not sure if that's Lisa Grundle or Lisa.
Lisa, this is Lisa Grundle. Is that the one you're calling on?
I think so. I couldn't tell who it was. I could only see the name Lisa.
Right. It's always confusing because there's usually two of us on. Yeah, this is Lisa with Health Facilities Planning, and we have been digging into a lot of your data over the last couple months. And in August, we'll have a good update on all of the data that we've got from the last 6 months. So thank you, everyone, for providing the data and being patient for us as we've come back and asked for more. And we'll have a report on that in August.
Great. Thank you for being here. We'll talk a little bit more, just a little bit about that data component. Kelly, anything new going on where you are?
Hi, good afternoon. Yeah, there's great things happening with Out 360 and at the Nest. At the Nest, we have regular events that we're hosting for mostly youth and young adult ages 13 to 25, and our population and traffic just continues to grow with those young people. So we're really excited about that. I'm going to jump on Chief Black's train of hopefulness. We have that are really going to help progress and support the young people in our community. We just signed a purchase and sale for the vehicle. Thank you to this group. We're going to be able to now expand our outreach for homeless youth and provide services for our young folks in the Pfeiffer House, as well as here at the Nest for those people that may need it. And lastly, again, riding the hopeful train, we actually may be able to have access to 5 more housing units for youth and young adult in the community. So if anybody's got some ideas and money and funding ideas around that, please give me a call, because we could use the assistance and getting traction to get those spaces for our young people.
Great.
That's it for today.
Lots going on there. I want to thank Apple and Veronica and those who have helped wrangle the vehicle purchase through the county contracting process, and everybody's understanding of what it's going to look like when we finally get it in place. Chief McKern.
Well, hi, folks. Hey, sorry if I'm gonna turn the camera off in a minute. I've got some low bandwidth. Talking to you folks from the great town of Packwood and Randall at a fire down here. What's going on in Cool Scene in the South End is it's kids time. It's end of school year. I think I'm spending more time at the school than I am in my own office. They have functions going on every
I don't know if that's my connection or his, but I think we can't hear him. Is everybody else experiencing the same thing?